Welcome everyone to Aeroflow Health's webinar. As part of our Aeroflow Advantage Be in the Flow webinar series, we're really pleased to talk with you today about member outreach and engagement strategies that improve outcomes, trust, and experiences for health plans and their members. I'm Mike Cantor, and I'm going to be the moderator for this presentation. I'm really excited to be joined by Nicole Peluso and Ryan Bullock. We'll introduce them in just a moment. But first, a few housekeeping things. So before we begin, really the goal of this series is to talk about challenges for health plans that Aeroflow is actually really good at addressing. And today we're going to be speaking about engagement, which is something where, as you'll see from the numbers, Aeroflow has a long tradition of successfully engaging pregnant people, new moms, and really helping them throughout their maternity journey. Last time we spoke about diabetes and the role of nutrition and helping to better manage diabetes. Nutrition is a theme that you'll hear about more today as well. And then as we go through this, we're going to have the opportunity to have questions and answers at the end of our presentation or sooner if it makes sense. So please feel free to submit questions in the Q&A box or in the chat. We'll have people monitoring that as well. And really, really looking forward to a robust interactive discussion with those of you who are with us live. And for those of you who are watching later, hopefully you'll find it enjoyable as well. So as I mentioned, I'm Mike Cantor. I'm the Chief Medical Advisor for Aeroflow Health. And with me today are Nicole Peluso, who is the Lactation Services and Education Manager for Aeroflow Breast Pumps, and Ryan Bullock, who is the Chief Strategy Officer for Aeroflow Health. Both have extensive experience in working with Aeroflow and working with the folks who use Aeroflow to access lactation services, breastfeeding education, and a variety of other supports, including a lot of social media that we'll talk about. Really, it's an exciting program because it really creates community for moms all along their maternity journey. So let's jump in. So unfortunately, in the United States, we have significant lack of access to care for expectant moms and for new moms. And you see some statistics here on the left side of the slide. 35% of counties in the U.S. are maternity care deserts, where it's hard to get obstetrical and gynecological services. 40% of women who have babies do not actually have a postpartum visit. 80% of maternal deaths in the U.S. are probably preventable, and 2 out of 3 actually occur during the postpartum period after the woman has given birth. So what this points out is a real need to help people access services and to engage with them, not just right before they deliver, but all throughout that maternity journey. And we'll talk about that journey and the continuum of care in just a minute. But before we get to that, Nicole, can you share with us your experiences in terms of member engagement? How does the opportunity to work with expectant moms and new moms really open up great opportunities for health plans to better engage their members? And how does Aeroflow collaborate with not just the members, your patients, but with their health plans as well?
Yeah, thanks, Mike. Pregnancy is a time when mom really needs help navigating what's happening to her. And there's just so many unmet needs in the US maternal healthcare system. So we help support those moms try to figure out where to go to get their help and then what they might need to know later, because they actually don't really know. We want them to feel heard about their concerns. We want them to be prepared. We want them to have agency in their choices, to even learn how to make an informed decision. We spend a lot of time with them talking about how to, if something new comes up, because birth and pregnancy are always a little unpredictable, how do they make an informed decision if they're given some options? And then by offering that preparation and education, we think that that reduces their costs, like C-sections and preterm births. So a mom who wants to have a low intervention birth is much more likely to have it if she has some information about what that looks like. And then we want to also consider their mental health. So moms are very aware of mental health. It's something that they bring to us often. And there's a lot of anxiety that can come up around birth. So many of our staff are dual credentialed lactation consultants and perinatal mental health providers. They get a certification through Postpartum Support International to try and address those needs so that they're not dealing with a postpartum mental health crisis later.
So you really have a holistic approach that engages not just around lactation and breastfeeding, but also behavioral health, nutrition, doulas. So there are a number of different areas that you guys cover, correct?
Correct. Yeah,
Fantastic.
we have doulas, labor and delivery nurses. We have people who are actually training to become therapists right now because there's such a great mental health need, and we have registered dietitians on the team. So it really runs a gamut of what moms would need in that period of her life.
Wonderful. Ryan, most people think of Airflow as a durable medical equipment or DME vendor. This seems unusual that a vendor has the extent and the kinds of services that Aeroflow has put together. Can you speak to how Aeroflow, why you decided to do that, and how it helps Aeroflow partner with health plans to get better member engagement and to help them build trust with their members?
Yeah, that's a great question, Mike. And one of the things that I try to I joke with the team, try to preach from the mountaintops of what we're able to do is access members, and it's that access and engagement is the second piece. And so not only were we able to access the members that are with health plans, but we're able to get those members to engage. And that entry point for us is the breast pump, and we help those moms navigate a lot of what Nicole just shared through that process. And so we built some trust with that member, and where we find a great opportunity is working with health plans to be able to extend that trust and share that back with the health plan, as well as other providers in the continuum of care, and connecting them back to their OBGYN, connecting them with their newborns pediatrician, and keeping that healthcare journey for mom connected, if you will.
Fantastic. Mike, let's talk about that continuum of care. And this is a story, actually. You see the woman in the picture down on the left. She actually, this is a story based on a true story from one of our health plan partners. So she actually got pregnant, tested positive, had an early miscarriage, unfortunately, then was able to get pregnant again. And what you see here is sort of a continuing journey where Aeroflow is collaborating with the health plan and maternity resources in the community to really walk through these different stages. Ryan, maybe you can explain to us sort of how this supports engagement and how the different steps of the process and the continuum of care actually support mom. Nicole mentioned how planning is so critical, and you can see all these different boxes. And even this understates the complexity of reality of navigating through pregnancy, having a new baby, going back to work. Maybe you can share with us sort of how Aeroflow is successful in supporting each of these different steps along the way.
Absolutely. And I think as the first box there calls out is that Airflow engages with the majority of the moms at the end of the first and start of the second trimester. Uh, Nicole has joked around that we'll have moms come to us several weeks after she has identified a positive pregnancy, but the majority of the moms come to us at that end of the first, start of the second trimester. And it's an opportunity, as I mentioned earlier, for us to engage with mom to be able to extend the trust and help her navigate through really her first major interaction in healthcare, right? This is um, a new experience for mom to begin navigating, to understand what benefits are available, what are the parts of the journey that she should begin thinking about, which Nicole and her team spend a ton of time trying to solve for. And a couple of things that we do is, as we mentioned in the next box, there's the digital therapeutic sessions that we're introducing mom to, as well as lactation classes, even in the prenatal period, as well as the postpartum period, is continuing to build trust, that those micro deposits of trust with that patient and member. For us, one of the ways that we measure engagement and what we see is just the open rate and click-through rate in our email campaigns that we send out to provide knowledge, information, and get those interactions when mom might need to come back into the healthcare journey. we see an open rate of 75.05% on emails and a 15.27% click-through rate, which, to give that perspective, on average, 34% is the industry standard for open rate. So we're more than double on that. And then a 1.3% click-through rate. And fortunately enough, we're very connected to the mom, and mom's very connected back to us. And I think that allows us to continue that connection with mom throughout the journey, as the slide highlights.
Yeah, I think that those are amazing numbers, actually, in terms of the click-through rate 10x and over double for the open rate. I think part of engagement that doesn't get enough recognition is that you have to offer something that's of value to the member. Health plan can't just say, this is good for mom, so we're going to send out a bunch of messages and expect that mom's going to respond unless mom actually feels like there's value there. And so that's an critical important, whether it's for maternity or whether it's for managing diabetes or high blood pressure or sleep apnea. It doesn't really matter. That engagement at its core is has to have value. It has to be important, personally important to the person who's getting those services. Nicole, is there anything you'd like to add to what we've talked about so far about the maternal journey and this continuum of care?
Yeah, we're also seeing engagement on the marketing side is the mom being very engaged with our social media. We have over 40,000 moms in our Facebook group, and they're posting all the time, and we're tracking now how they're coming back into the program. So they go there for support, they meet friends there, but then at different points in their journey, they're guided back to the program. So let's say that they came and took 4 classes with us while they were pregnant, and they've now engaged in this group, but they're ready to go back to work. They come to our class to prepare to go back to work, and we can see that movement back into the program. So there's a social aspect, but the educational aspect is there throughout as she needs it.
Fantastic. On average, do you know how many classes if someone signs up for a breast pump from Aeroflow or other services and they do go ahead and elect to take a class, how many classes are they taking or how many educational videos do we have any data on that?
It's usually about 4. And then we also offer appointments. So if mom is struggling with something specific, and that often happens after the baby is born, that she wants to show how she's nursing and what might be off, they'll have those one-on-one touch points, which I think is really helpful. So they have places for social engagement, they have places for group classes, but also that individual attention when they need it.
Fantastic.
And Mike, if I could, it looks like
Yeah.
a couple questions along the continuum of care here, and I'm happy to share a little bit. Nicole, maybe you can help with this as well. The question was, during the continuum timeline, how is Aeroflow supporting mom between the events and interactions? I would respond to that in several things that we're doing is we meet mom where she wants to be met and how she needs to be met during that week of pregnancy, and so we track that throughout the pregnancy journey with mom, and so we're meeting her with content, education through email, the Facebook group that Nicole had just mentioned, as well as offering classes, lactation classes, nutrition classes, and education where mom can come in and be a part of a community to learn more about this healthcare journey that she's on. Nicole, anything else that you can think to add, maybe more specifically?
Yeah. We also have a weekly support group, and that's a really great place where moms can come with their questions, but the other moms are also supporting them. So if a mom is postpartum, she can kind of share what she's gone through to that mom that just had her baby 2 days ago. And so that's kind of a nice environment where you have a facilitator, but the moms actually connect with each other.
Fantastic. And Ryan, the other question in the chat?
Yeah, the other question is, does your Airflow Facebook group include moms across your healthcare or health plan clients?
Yes, and people are coming in from the outside because it's, you can publicly see it. So they're coming in from all different places, but people who have insurance and have gone through our program, and then people who are coming into our program from that direction.
Got it. And I just want to highlight as well, there's a part here, the 6 weeks postpartum visit, which is traditional for a new mom. The behavioral health aspect of this is something that's gotten a lot more attention within the programs at Aeroflow recently, right, within the last couple of years. And you mentioned, Nicole, that there are people even becoming therapists who are on our team at Aeroflow. Why that change? What drove this new emphasis on behavioral health?
I think COVID, I think the moms who are having babies now were in college and didn't have such a great experience and started reaching out for some mental health support back then. So it's something that's been already in their lives. So when they're having a new life event, they do want to check in with their mental health. They've sort of demanded it. It's not something when our program started 5 years ago that we thought that much about, but because the moms were asking for it, we have shifted focus a little bit, creating the support group and getting these additional credentials for our team. The person who's becoming a therapist actually spends time each week calling the OBs if there is a concern about somebody's mental health and letting them know so that they can help guide them to get additional resources.
Fantastic. I see there's one more question, but I want to come back to that one about nutrition. So, Sherry, hold on. We will get there. Ryan, this is a slide with a lot of great numbers. Can you tell us a bit about the most important ones on this slide that we think the audience needs to know about? And tell us how engagement enables Aeroflow to get to these great numbers.
Yeah, I think I mentioned access and engagement. One of the parts that I think really stands out is that we reach 42% of all births in the US annually. And then of the 42%, 50% are in maternal care deserts. And so we're able to reach moms that don't have the access to the same as their counterparts in urban areas would have for that maternal journey. And then going back to engagement, I think that one just right up above, 30% of our referrals come from family and friends. And I think that really stands out and resonates to the brand that we've built and the trust that we have, not only with the patients that we've been fortunate enough to serve in the past, but they're also telling their friends and family who are going through pregnancy to reach out to Aeroflow for the products and services that we have available.
Fantastic. Now, Nicole, you mentioned that the program has evolved over the last 5 years. Can you tell us a bit more about some specific things that Aeroflow is doing now that are a little bit different and how you see things continuing to evolve in terms of improving engagement and getting even better outcomes than the ones you see on this slide?
Yeah, I feel like the moms don't want to feel like a number, and the OB offices are very full. And so the appointments are quick, and they really are demanding some more time and attention to get their questions answered. So they want a partner that they trust who can kind of alleviate their fears about birth, as well as, like we mentioned, the mental health concerns. And we also are including the partners. So when the partners want to come to an appointment or come to a class, we really encourage them to come. We talk a lot about what support she can get in her immediate community. And one of the ways we facilitate that is doing birth plan appointments. So we would teach about how interventions could affect breastfeeding outcomes. And she would say, well, how do I talk to my provider? And so a birth plan is a great way to have sort of a written piece of communication, not just to her OB or midwife, but also to the nurses that she's never met before in the hospital. So we meet with them twice individually and go through all of the options of the birth plan and then create a really simple one for her that's bullet pointed, easy for the nurses to read. and gives them time to really think through what their choices are. So even though birth is unpredictable, you're more likely to get the birth that you want if you've actually identified those things that are important to you. And so we put them down on paper, and she's able to leave with something really concrete that she can use to talk to her providers and sort of create the environment that she needs. And her partner or support person is really involved in that whole process as well.
Can you give some examples of some of the specific choices that the moms are making? And can you speak about the role of doulas? We mentioned it briefly earlier. I'm just curious, is this part of that process? What's their role in facilitating this?
Yeah, so many people on the team are dual credentialed lactation consultants, doulas. That's one of my other credentials. And doula, typically people think of doulas as being there during the birth, but there's only so much you can kind of support during the birth. The real important part of it is the education beforehand. So in a perfect world, a doula goes to the birth and actually does almost nothing because the mom has been well prepared, feels confident in what's happening. So it's all of those sessions beforehand that can make the outcome afterwards better. So we have found what we call a virtual doula to hold their hand through all of that prep, to be able to meet with them after for the kind of mental download that they want to go through and tell their birth story. And but specific choices would be if they want to use drugs or not use drugs. What are the outcomes if you use an epidural? Many people now are having an epidural without the opioid side of it. So they're still getting the pain relief, but not having the drugs that might interfere with breastfeeding. And a lot of people don't know that's, a choice that's on the table in many hospitals. So that would be, I would say the epidural is kind of the biggest one where they're sifting through whether they want that to happen. But even when the IV goes in, you can delay an IV so you can walk around the hospital a little bit. A lot of moms don't really even know that. So we can talk about what that means and why their specific case might need the IV sooner or later.
Nicole,
Great. So
you
it's
you had
really
shared with
good.
me previously the number of visits a patient goes through with a doula and the value that you've seen in that. I know it kind of ties in with everything that you've mentioned, but I can't recall the number of visits.
So I would say a typical doula does 2 appointments before. When I was heavily involved in doula work, I would do 6. I just felt like more education and more preparation was always better because you had to get the support person on board. You weren't there to replace the support person. You were almost there to give the support person a crash course in how to support the wife or the partner or the sister, or, whatever their role was. And so that takes time and trust. If they don't kind of trust that what you're saying is true, or they don't even trust each other, so you're helping the partner and the patient have a conversation about their needs. They often don't even talk about that. So somebody might really love massage, somebody might actually not want to be touched, and partners have never had that conversation. So we help facilitate, because there's support measures you can do, but not everybody wants the same support measure. So just helping the couple have these conversations can really go far, so they're not having them on the day of the birth.
Fantastic. So, sorry a second. There we go. We have the technology, we just can't use it, right? So here we go. Ryan, tell us about how all of this works together to create trust. What's Aeroflow doing to really thoughtfully and consciously emphasize certain approaches to accomplish the big goal, which is trust? My sense as a physician is that if your patients don't trust you, they're not going to follow your advice. And it's the same kind of thing. If they don't feel confident about what their choice is, they don't feel like they're supported, they're going to struggle more. So what's Aeroflow doing here to really underline and really emphasize that?
Yeah, I think for us, what we found is through that week of pregnancy that I mentioned previously, and making sure that we're providing the right content, the right education. Um, the mom is seeking to understand where, what this process looks like. And I think we've built trust with mom in providing the products and services, but also providing the education along the way to help meet mom where she is through that journey. Um, and through that, we continue to see great engagement. For example, on our websites, uh, for aeroflowbreastpumps.com, we find mom spends 13 minutes on average on the website seeking information, trying to educate herself on the breastfeeding journey. And as highlighted here in the slide, Nicole mentioned this earlier too, is that we've got over 40,000 members of a private Facebook group. And we had a stat that came out last month in April that showed we had over 90% engagement with the members of that Facebook group. So we had over 35,000 moms that engaged in a post, comment, or reaction, which I think really speaks highly to the moms are they're seeking information. We're providing information. We're also providing a mechanism for moms to connect and gather that information from other moms. Um, and to put that into context, Facebook states that a average engaged Facebook group sees about 30 to 50% of those interactions from the group, and a highly engaged Facebook group sees about 60 to 80%. So we're um, breaking the barrier there on a highly super engaged mom base that is seeking information and knowledge, and able to find a place to get that information.
Great. Nicole, one of the questions earlier is sort of about how do we customize or how do we focus on one-to-ones, cooking classes, nutrition? How does that fit into engagement in terms of identifying the specific needs of a particular person and then making sure that that expected mom or new mom is getting the specific support that they need? Maybe using nutrition as an example of how you work that.
Yeah, I think it's important to mention that our mission at Aeroflow Breast Pumps involves making things easy for mom. And that's understanding where she is and what her lifestyle is like, what type of learner she is. So we have 450 classes per month. There are 21 different class topics that we teach on. There are over 50 providers on the team. So the pure volume of options for her, times where she can sign up. We start out at 9 a.m. Eastern time, and our last class is at 10 p.m. So if a mom has a certain work schedule or personal life schedule, we're there for her when she needs us. So it's quite easy for her to find what she's looking for. Our classes are also formatted differently for different types of learners. So we'll have a 90-minute long form lecture type class, and then we'll have shorter classes that are more like a mini education plus a lot of discussion for those more specialized classes. So we have a class, for example, on NICU and high risk. So those moms who are concerned about maybe having that journey, most of the people that come are pregnant. We give them some education about what to expect in the NICU, and then we give them a really long period of time in that class for Q&A. We have introduced nutrition. It's been around for the last 3 or 4 months, and it's one of our most highly engaged classes. Moms want to make sure they're eating well for themselves and their baby. They want to know, is there anything specific they should be eating for breastfeeding? We are working on a diabetes class for people that need more specific dietary recommendations. And we're moving in the future into more overall wellness, how they can incorporate exercise and lifestyle choices for good health. And we're finding that moms are really interested in that topic.
All this is available pretty much for everyone, right? It isn't like there's a huge additional expenses there. I mean, how does that work in terms of who's eligible and who can access all of the different things that you're doing?
So our classes are either billed as lactation classes or nutrition classes. So the topics kind of span the gamut. So in our lactation classes, our focus would be lactation. So it's birth through the lens of lactation. It's baby care through the lens of lactation. It's infant sleep for those moms that are breastfeeding. Nutrition classes are a wider scope. So if moms are not breastfeeding, they can get a lot of support there. So we do have classes that involve baby feeding within the scope of nutrition. So moms who are having alternate feeding options, they're welcome there. So there's really nobody who's left out of our class offerings. So for example, we've talked a lot about birth, but we also have a C-section class. So somebody who is planning for that or is worried that might happen to her, she's able to go and talk to, it's usually people who've had C-sections themselves who are teaching the class and help prepare for what their options are, because there really are some options that mom needs to think through for her C-section as well.
Got it. Ryan, anything to add?
No, I think that's when you think about barriers to engagement and getting access, I think one of the things that I've spoken quite a bit about here today is education. And it's not only education on that journey that she's going through, but it's also what does her health plan cover, and what benefits are covered by her health plan, and that obviously does vary from plan to plan. And that's where we try to take the headache out of healthcare, if you will, and make that as easy of a process as possible to know, what products and services, how many visits are available, and things such as that. And so, I think to go along with what Nicole said and getting into the meat of what those are, that's what I would add.
Great. On to the next slide. So you mentioned barriers a second ago, Ryan. So what are some of those barriers that you guys see, and what are the tactics you're using to overcome them?
Yeah, I think it's not often understood that prenatal education is the largest driver of a successful breastfeeding journey. And I think not only is it a success, it leads to a successful breastfeeding journey, but I think it also leads to better mental health outcomes. Just the more informed and educated we can help that member, that patient become, the better informed she will in the decisions she has to make through that process. I know Jen Jordan, who oversees our mom and baby division, has shared that no one talks about a feeding journey, but a lot of time is spent on the birth planning, the nursery design, baby showers, registries, and things such as that. And so we're trying to fill that gap where mom needs that extra help and support. And we think that that's a barrier, even in the postpartum period, is helping mom understand that she's got a new baby. She's obviously got to care for the new child, but she also needs to care for herself, and helping her navigate through that part of the postpartum period.
Nicole, what are your thoughts?
I think there's a little bit of an issue with health literacy. When mom doesn't really know what is about to happen, she needs things broken down to her in really simple language that she can understand. And I think that's part of why our newsletters get such high click-through rates. Like, she understands what we're saying to her, and then that translates into getting her the care that she needs. Also, just trying to reach her where she is. So we know one of the barriers for for reaching moms is that second time mom. She's just simply more busy. And we have put together a 30-minute mini class, which is really like an extended TikTok to just get that information to her in really clear, small bites that she can absorb, because she's told us that she's really short on time. So being clear with what the offerings are, what somebody might need in that time period. Because if you just throw out the words like lactation and nutrition, she goes, oh, I think I need something like that. But really trying to explain to her all of the stuff that's coming up with baby and all of the choices she's going to be needing to make, and then holding her hand through that whole process.
Got it. So there's some general themes. One would be personalization, like you said, figuring out if there's a second time mom, she's going to need something different perhaps than the first time around because she's already had some experience, maybe good, maybe bad. But in general, like you said, meeting people where they are, making sure that you understand what those needs are and address those specific needs and add the most value for that person. Whether it's addressing, the unspoken in many cases issue of health literacy, just understanding that we should always be communicating at the common denominator in terms of being able to reach the broadest possible audience, or understanding their specific needs in their community, or if they have different cultural beliefs, being able to really focus on the specific needs of that particular mom. Looking ahead, changing topics for a second, what are you most excited about in terms of the future of maternal health engagement, whether it's policy, innovation, or member feedback? Nicole, do you want to go first?
I'm excited about our nutrition program, since that's just getting off the ground and moms seem to be responding really well to it. I think it balances out the focus on the baby, which is what's going on mostly in our lactation classes, and turns it over to her. And as we weave the mental health into these different classes, we have a mental health partner that we work with who also really enriches our program, helps train our staff to be incredibly sensitive culturally, as you mentioned, and just really helping them read where the mom is at and meet her where that is. And I think also our automation, the self-scheduling, like that cannot be underestimated. We have a really smooth way for her to get involved, and technology is a big factor in that. And I feel like we do a really great job in that area.
Fantastic. Ryan, what are your thoughts?
Yeah, for me, it's taking all the great work that Nicole and the entire mom and baby team here at Aeroflow is doing, and helping with that holistic approach in this part of the maternal journey, and leveraging that along with the access and engagement that we have with the member and patient, and working alongside health plan partners to look at ways that we can close care gaps. How can we reduce the number of interventions that the member is having to utilize in this part of the healthcare journey? And I think the other piece is I'm excited about we're slowly starting to make the change, as you mentioned earlier, that Aeroflow typically is looked at as a DME supplier, and that's the entry point for us. And so we're utilizing that to begin to have Aeroflow thought of as a health solution provider and helping close care gaps, helping connect that member if a health plan has a care management program that for elevated risk patients, that we can help get them into that program and create a smooth transition in doing so. And so that gives me a lot of hope and excitement. We've got a great team that's doing a lot of great things, and extending that into our health plan partners, really excited about.
Fantastic. Thanks to both of you. Great, great responses. We have just a couple of minutes left. So if people watching live have a question that they haven't addressed, please put it into the chat or the Q&A box now. The buttons are at the bottom of your screen. Meanwhile, I'll ask one last question from us, from the panel. Um, if health plans could do just one thing to better engage moms in this coming year, what should they do differently?
I would go back to what gives me hope and excitement. It would be to branch out and open up beyond the physician groups that I think they traditionally lean on. Um, and even some of the member engagement vendors that are out there helping them connect with the member population is uh, think of Airflow, consider us as an extension as well to be able to tap into that population and take those small micro deposits of trust that we've established with the time that they've been with us and let us help extend that into back into the health plan or back into the healthcare ecosystem more broadly.
Great. Nicole, what are your thoughts? One thing that a health plan might do differently to really engage expectant moms or new moms.
Just think realizing that moms are really in a different place than they were like a generation or two ago. Most of them live separate from their families now, and they're not learning about parenting from their community. So our telehealth options are really essential for her to find that community and to find that trusted information. There's a lot going on, TikTok, other social media, and the advice isn't great. And so moms can easily be steered in the wrong direction. So I feel like it's not just them trusting us, but it's trusting kind of the system that we've built where they can get just really basic, important data about how to care for themselves and their baby in our classes, but then they're able to engage with each other in a moderated format in our Facebook group and our moms support group, where they can be really assured they're going to get accurate healthcare information. Misinformation is unfortunately really rampant out there. And I think making sure that the people giving the information are well trained and really our group is the best of the best. I'm the one hiring them, and we get a lot of people wanting to join our group, and they're just really, really stellar providers.
Excellent. It's great to hear that you've got such a great team, and the reality of misinformation is a growing importance, unfortunately. So to have a trusted source of information that's providing evidence-based approaches, but also understanding that it isn't just this is not a medical issue. It is a life. It's coming into the world. It is a behavioral health stressor. It is changing the way you're going to live as a parent. You're going to live differently, whether you have kids before or not. Every new kid changes your job a little bit. So it's great that Aeroflow has built this and done it so well, and it is now becoming even more comprehensive. I think that's really exciting, is to think beyond just that birth-specific journey into nutrition, behavioral health, wellness. I think that makes so much sense, and I think it's really what people want. So thanks to both of you for an outstanding discussion. As always, our time flows by so quickly because it's an easy conversation to have with real experts like you guys. Just a couple of housekeeping items, and we'll close up for today. The webinar link will be shared with everyone, so you can watch it on demand and share it with your friends, of course. Please feel free to subscribe to Aeroflow's newsletter. Take the survey if you would. We'd love your feedback to help continue to improve our webinars as we move through the year. They are quarterly, so another one will be happening in the fall. And then follow Aeroflow on social media. As you've heard, social media is a major way that moms are engaged, and it's a really great opportunity to keep up with everything Aeroflow is doing to support members of health plans and health plans directly. So most of all, thanks to all of you watching, whether it was live or on delay. Really, really appreciate the opportunity to share with you. And again, love to have your feedback, and hope you'll join us in a few months for our next Aeroflow webinar. Thank you so much.